We are presenting a case of lithotripsy for remnant variant cystic duct stones. Patient is an elderly gentleman who underwent DRCP outside for bile duct stones followed by cholecystectomy. He is referred to us for management of retained stones in the remnant cystic duct. As we can see from the MRCP images, this cystic duct has a long course with a variant anatomy. It runs parallel to the distal bile duct and inserts along with the bile duct and the pancreatic duct at the ampulla of Vater. And multiple stones can be seen in the remnant cystic duct, and the largest measuring about 4 to 5 millimeters in size. So we did the removal of the biliary stent. A wire-guided biliary cannulation was done, cholangiogram and balloon sweeping was done, and then a wire-guided cystic duct cannulation was done from the ampulla of Vater. However, the stones could not be removed by balloon sweeping. So we did a 12 mm balloon sphincteroplasty of the cystic duct orifice at the ampullary level, and the cholangioscope was introduced over the wire and later by freehand technique. So we can see the bile duct stent in situ which was removed. A selective biliary cannulation and cholangiogram was done which showed a single bile duct stone also. And then we did a wire-guided cystic duct cannulation of the remnant cystic duct, and over the wire the cholangioscope was introduced inside the cystic duct. Now once the cholangioscope is introduced, we can clearly see the inside of the cystic duct, and at the very end we can see a black spot which represents the lowermost cystic duct calculus. About 5 stones are packed one top of each other in the remnant cystic duct. So even though the cholangioscope was inside the cystic duct, we could not comfortably push the laser fiber through the cholangioscope. So the cholangioscope is slowly withdrawn and taken out into the duodenum, and the laser fiber is preloaded to the tip of the cholangioscope, and without the use of a guide wire, a freehand cannulation of the cystic duct orifice at the ampullary level was done using the cholangioscope. Now again we are getting clear images from the inside of the cystic duct. The laser fiber this time could be comfortably pushed out of the tip of the cholangioscope, and the lowermost stone is visualized. The laser fiber is positioned about 1 to 2 millimeters near the stone, and it is pulverized using laser lithotripsy. And of the 5 stones, each stone was pulverized one by one using laser lithotripsy. A thorough constant irrigation is done, which is helpful in pushing the cholangioscope upward and removing the small stone fragments. So all the 5 stones were pulverized using laser, and the stone fragments from the cystic duct was removed by repeated balloon sweeping. These stones are coming from the cystic duct, not from the bile duct. So all the calculi have been pulverized and removed using laser lithotripsy and balloon sweeping. Patient got discharged next day itself. Thank you for the patient listening.